Have you noticed changes in your size or firmness during sex and quietly wondered if there's anything you can do about it? I'm Dr. Laura Stone, helping men understand and make sense of the changes that happen in their bodies as they age. As men age, several things begin to shift. Blood vessels may stiffen, testosterone may decline, and pelvic floor muscles can weaken. The pelvic floor isn't just about bladder control. It's a group of deep, supportive muscles that play a direct role in your ability to achieve and maintain an erection. Two of the most important are called the bulbocavernosus and ischiocavernosus. These aren't names most men have heard, but they're doing important work behind the scenes. The bulbocavernosus muscle contracts to help trap blood in the penis during arousal, keeping it firm and stable. The ischiocavernosus adds to that pressure and helps maintain the upward angle that many men associate with youthful function. Together, these muscles compress key veins and support the erection from inside the pelvis. When these muscles weaken or lose coordination, which is common with age, prolonged sitting, prostate issues, or simply disuse, blood tends to escape more easily. The result? Erections that don't feel as firm or seem shorter, or that fade more quickly than they used to. This is where pelvic floor muscle training, sometimes called PFMT, comes in. It's a structured set of exercises designed to target these exact muscles, rebuild control, and reestablish the internal pressure that supports erection quality. If your goal is to feel stronger, fuller, and more in control of your body again, this might be one of the most underused tools available to you. Now that we understand what the pelvic floor muscles do, let's take a closer look at what the research actually shows, especially for men over 60. In a randomized controlled trial conducted by Dr. Grace Story, they followed men who were dealing with mild to moderate erectile dysfunction. After just 6 months of consistent pelvic floor muscle training, over 40% of participants regained normal erectile function, and another 35% reported noticeable improvement in their firmness, control, or satisfaction. That's more than 3 out of 4 men seeing measurable benefits. And importantly, these men didn't change their medication or undergo any procedures. They simply learned how to isolate and train a group of muscles that had quietly weakened over time. So, what's driving these results? It comes down to something called veno-occlusive function. When you strengthen the bulbocavernosus and ischiocavernosus muscles, you support this valve system. You create the internal pressure needed to hold blood in place longer, which means harder, more sustainable erections. But strength alone isn't the full picture. What many men need, especially after 60, is not just muscle power, but neuromuscular control. That's the brain's ability to quickly recruit the right muscles at the right time. And this is where biofeedback makes a meaningful difference. Biofeedback is a technique that gives you real-time information about how your muscles are working. That might involve gentle sensors, guided apps, or clinical tools that help you learn exactly when and how to contract the pelvic floor, and just as importantly, how to release it. In older men, this can speed up learning, reduce frustration, and lead to better coordination in daily life. There's another benefit worth mentioning. Many of these same muscles also support bladder control, prostate stability, and post-surgical recovery. So even if you're not currently dealing with urinary leakage or prostate issues, keeping your pelvic floor strong can help you stay ahead of common age-related challenges. It's also worth noting that pelvic floor muscle training carries very little risk when done correctly. It doesn't interact with medications. It doesn't require invasive procedures. And for many men, it offers a greater sense of control, especially for those who feel frustrated or dependent on pills that may lose effectiveness or come with side effects over time. For a large number of men, especially those noticing a slow decline in firmness, fullness, or stability, pelvic floor training is an evidence-based, practical, and empowering starting point. Most men start noticing subtle shifts within a few weeks. Improved muscle control, a more responsive feeling during arousal, and in some cases, a firmer upward angle. But just like any form of training, the real progress builds over time. As we mentioned earlier, 2 specific muscles are at the heart of this conversation: the bulbocavernosus and the ischiocavernosus. When both of these muscles are strong and well-coordinated, the result is an erection that is not only firmer, but also more stable and longer-lasting. You might notice better angle, more fullness at the base, and improved sensitivity because the nerves and blood vessels are being supported properly. But when these muscles weaken, which naturally happens over time, especially without targeted use, blood tends to escape too early. The result can be a flatter or softer erection. Many men also report that their erections look shorter or smaller, even though the actual size of the penile tissue hasn't changed. And this is where we get to the idea of perceived size. Technically speaking, pelvic floor exercises do not increase the anatomical length of the penis. That's not what these muscles are designed to do. But they do increase the pressure and fullness of blood within the erectile chambers, and that can change how the erection looks and feels. There's also a neurological component to this. When these pelvic muscles are activated correctly, the brain often experiences improved sensory feedback. That means you don't just feel stronger physically, you also feel more aware and connected. Many men describe this as having better control, better rhythm, or even more pleasure during intimacy. That's not a coincidence. It's the result of improved communication between the brain, nerves, and pelvic floor. It's also worth mentioning that strengthening these muscles can help reduce strain on other systems. For example, many older men compensate for pelvic weakness by overusing their abdominal muscles or holding their breath during intimacy, which can raise blood pressure and lead to unnecessary tension. A well-trained pelvic floor allows for more natural movement, less fatigue, and fewer distractions, all of which support a healthier experience overall. And while results vary from person to person, most men who commit to pelvic floor training for 8 to 12 weeks report better angle, longer duration, and improved confidence in their erections, even if the actual dimensions remain unchanged. So, how do you actually begin? The good news is that pelvic floor training doesn't require equipment, gym access, or invasive procedures. But it does require consistency and a bit of patience. The first step is learning to identify the correct muscles. The easiest way to find them is during urination. Try gently stopping the flow midstream. The muscles you use to do that, without clenching your thighs or holding your breath, are part of your pelvic floor. That's not a training technique, just a one-time test to locate the right area. Once you've identified the sensation, you can begin practicing outside of the bathroom in a more structured, controlled way. Start by sitting or lying down in a relaxed position. Take a few normal breaths. Then gently contract those same pelvic muscles, as if you were trying to lift or hold something internally. You shouldn't feel tightness in your abdomen, legs, or chest. If you do, ease off and refocus. The goal is to isolate only the pelvic muscles. Try holding the contraction for 3 to 5 seconds, then fully release for another 5 seconds. That release phase is just as important as the squeeze. Over time, you can gradually increase to 10-second holds with full control. Most men benefit from doing 2 to 3 sets of 10 repetitions per day. You don't need to do them all at once. A few gentle rounds in the morning, afternoon, and evening can fit easily into most routines, without strain or discomfort. Now here's where it helps to think like an athlete. You're not trying to push harder every day. You're training for control, not power. And like any skill, the early results are often subtle: improved awareness, easier muscle activation, better stamina during intimacy. These small improvements build the foundation for more noticeable benefits down the line. If you've tried before and felt unsure whether you were doing it right, you're not alone. As mentioned before, many older men benefit from biofeedback guidance. These tools can accelerate progress, especially if you're someone who learns best by seeing or feeling direct feedback. That said, many men make excellent progress with basic daily practice, as long as they stay consistent. Here's what most men can expect over time. Weeks 1 to 2, you may start to feel more connected to the muscles, even if the contractions are still weak. Weeks 3 to 5, improved endurance and confidence, with less effort required to engage the muscles. Weeks 6 to 8, better control during intimacy, improved stability, and for some, reduced urinary leakage or urgency. By week 10 to 12, noticeable improvements in firmness, angle, and for many, enhanced perceived size, especially if blood flow was a limiting factor before. Along the way, it's normal to have ups and downs. Progress isn't always linear. But if you stay the course, you may be surprised by how much difference a few minutes a day can make. And remember, these exercises don't just support erection quality. They help with bladder control, post-prostate recovery, and even reduce the risk of future pelvic instability. So even if intimacy isn't your main concern, pelvic floor training is still a smart investment in your long-term health and confidence. If this helped clarify things, consider subscribing. It's a small step that helps more men find accurate, shame-free health information just like this. And if you decide to begin pelvic floor training, know that it's a doctor-approved approach that's safe for most men over 60 and one that's helped many feel stronger, more in control, and more like themselves again. And always remember, all information provided in this video and channel is for educational and informational purposes only. Always consult a medical professional about your specific circumstances and before making any changes to your lifestyle, diet, supplements, or medication.